Every hour of every day, someone in the United States is diagnosed with a deadly form of cancer called glioblastoma, brain cancer. And like clockwork from hell, 75% of them will be dead within 12 months. 95% of them won't survive 5 years. But what if we could teach computers to find new ways to fight this malignant disease? What if we could create hope where there is little? Today, that's exactly what's happening in research labs across the world. And it should be our collective task to expand this hope. Understanding the enemy starts with acknowledging each of glioblastoma's terrible powers. Brain cancer is a deadly puzzle with pieces that keep changing. This cancer is particularly difficult to treat because it employs several strategies to evade detection and destruction. First, it hides behind the blood-brain barrier, a protective shield that makes it difficult to deliver medicinal drugs to the tumor. Second, glioblastomas are highly heterogeneous, meaning their genetic makeup varies wildly within the tumor and over time, making targeting with therapies challenging. It's like fighting a shapeshifter that changes each time you get a target lock. Third, these tumors are masters of survival, stimulating the formation of new blood vessels to ensure their own supply of nutrients. They literally build their own supply lines. Finally, glioblastoma cells are incredibly invasive, infiltrating surrounding healthy brain tissue like roots, uninhibited, spreading through soil. This makes complete surgical removal extremely difficult, as any remaining cells can give rise to a new tumor. It's like trying to capture smoke. But there's a new hope, one powered by artificial intelligence. Understanding and targeting glioblastoma's unique strengths has become a crucial area of research. First, researchers are using AI to analyze genetic patterns for earlier cancer detection and improved treatment. Second, AI can analyze medical images over time, detecting subtle changes that might indicate cancerous growth. Third, AI can evaluate treatment responses and drug interactions in hours or days, rather than the years it takes human researchers. The holy grail would be advanced drug discovery. But finding cancer at its earliest stage, stage 0, would be nearly as valuable. Cancer begins with a single cell going rogue. This happens frequently in your body. Usually, your immune system identifies and destroys these zombie cells. A fitting description since these cells refuse to die normally and can infect healthy cells around them. Sometimes, though, these zombie cells evolve clever disguises. They can suppress the immune system, remove their molecular ID tags, called MHC molecules, that the immune system uses to spot them, or even camouflage themselves as normal cells. To become full-fledged cancer, these zombie cells must develop 3 key abilities: uncontrolled division, angiogenesis, growing their own blood vessels for nutrients, and metastasis, invasion of other tissues. The earlier we catch cancer along this progression, the better our chances of containing it and annihilating it someday. Once it spreads, it's like opening Pandora's box, nearly impossible to close again. But if we could spot and destroy these cancer cells early enough, we might be able to destroy the box and root out the cancerous infestation. This is particularly crucial for brain cancer, where the term remission is rarely used due to its aggressive nature and tendency to recur. The AI breakthroughs are already happening. At Stanford, AI systems are detecting tumor boundaries with unprecedented precision, helping surgeons save more healthy brain tissue. DeepMind's AlphaFold has made significant strides in predicting protein structures, which is crucial for drug discovery. While its specific application to glioblastoma is ongoing, it holds enormous potential for creating drugs that can effectively reach and target tumor cells. These advancements aren't just happening in research labs. Real patients are already benefiting. AI is helping doctors personalize treatments based on the unique characteristics of each tumor, extending lives and improving quality of life. AI-powered image analysis is helping surgeons identify the safest and most effective surgical approaches, even in cases previously considered inoperable. These are more than just statistics. They represent real people, parents, teachers, friends, gaining precious time with their loved ones. Now, for all the students and aspiring technologists listening today, this fight against brain cancer represents one of the most compelling applications of computer science and artificial intelligence you could ever work on. Let me tell you how you can prepare to join this critical mission. First, let's talk about education. Yes, you'll need to focus on the fundamentals, algorithms, data structures, and computational thinking. But you'll also want to deep dive into machine learning, particularly the deep learning architectures that are revolutionizing medical imaging. And don't forget about bioinformatics and computational biology. Understanding the biological aspects of cancer is crucial to developing effective AI solutions. The technical skills you'll need are like building blocks. Start with programming languages like Python for machine learning and data analysis, R for statistical analysis of medical data, and perhaps Julia for high-performance computing and bioinformatics. You'll want to master frameworks like TensorFlow and PyTorch for deep learning models, and get comfortable with specialized tools for medical imaging and genomic data analysis. But here's what's really exciting. There are so many ways you can start making an impact right now. You can join open source projects which focus on medical imaging AI tools, or OpenNeuro, which is developing platforms for sharing neuroimaging data. There are summer internships at major cancer research centers, undergraduate research programs in computational biology, and countless hackathons and competitions where you can put your skills to the test. Every line of code you write could be the key to saving someone's life. The future of cancer treatment is being written in code, and we need your help to write it. Whether you're just starting your journey in computer science or you're an experienced developer looking to make a difference, there's a place for you in this fight. Think about it. Somewhere out there, a patient is waiting for the breakthrough that you might help create. The algorithms you develop, the models you train, the systems you design, they all have the potential to transform lives. It's not just about building software. We're building hope for patients and their families. The convergence of technology and medicine has given us an unprecedented opportunity to defeat glioblastoma. This isn't just about writing code, it's about writing the future of medicine itself. And we need every bright mind, every creative thinker, and every interested programmer to join this mission. So I challenge you today. Learn, code, contribute. Together, I hope we can turn the tide against brain cancer. Let's build the future of medicine, one algorithm at a time.